When you're handed a morning med pass with 5 different cardiac pills for one patient, it's easy to feel overwhelmed. Trying to recall a textbook's worth of isolated side effects while the bedside monitors are beeping creates a level of uncertainty that every nurse has experienced. Subscribe now and visit our platform to access our full library of visual study tools and resources. This blueprint simplifies pharmacology. Rather than memorizing abstract facts, visualize the cardiovascular system as a machine, an engine connected to closed pipes and a drain. Understanding this energy transfer lets you predict how these drugs alter a patient and interact during your shift. This gas pedal, blocked by a brick, represents metoprolol. As a beta-1 blocker, it physically covers cellular receptors in the heart, preventing adrenaline from forcing the engine to rev up. However, in a crisis like sepsis, where blood pressure is tanking, the body needs a faster heart rate to compensate. In those moments, you must hold the medication to allow the heart the speed it needs to keep blood moving. It's equally important not to stop a beta blocker abruptly. If you do, those blocked receptors are suddenly uncovered and hit with a surge of adrenaline, causing a dangerous spike in heart rate known as rebound tachycardia. Now watch these constricting bands snap off the pipes. This is the effect of lisinopril. It inhibits the enzyme that creates angiotensin II, a substance that normally acts like emergency shrink wrap on your blood vessels. While lisinopril relaxes the pipes, it also causes a buildup of bradykinin. This usually results in a persistent dry cough, but you must be vigilant for angioedema, a rapid, life-threatening swelling of the airway that occurs at a statistically higher rate in Black patients. Managing the engine and pipes requires looking at the physical human in the bed rather than just following a scheduled time on a medication record. When this mechanical pump shuts down, it triggers a rush of fluid down the drain. This is furosemide. It blocks the sodium pump in the kidneys so that massive amounts of water follow the salt straight out of the body. There is a strict rule for this IV drug. You cannot push it quickly. Rapid administration causes fluid shifts in the inner ear, leading to permanent hearing loss and tinnitus. Furosemide creates a physiological trap. Flushing out water washes away potassium. In this cellular musical chairs, missing potassium leaves binding sites empty, aggressively occupied by digoxin molecules. Digoxin overbinds the heart, reaching toxic levels on a standard dose. Waiting for a patient to report seeing yellow-green halos is a mistake. That's a late sign of poisoning. The earliest indicators of digoxin toxicity are gastrointestinal. First, unexplained nausea. Then, sudden vomiting or complete loss of appetite. Recognizing the link between a patient casually skipping lunch and a potential arrhythmia allows you to request potassium and digoxin labs and intervene before the heart ever falters. To prevent debris from clogging the pipes long-term, we use atorvastatin. It inhibits the enzyme in the liver that serves as a cholesterol-producing factory. This gatekeeper being knocked offline is what happens when a patient drinks grapefruit juice. The juice disables the CYP3A4 enzyme in the gut, removing the filter and allowing a massive, unregulated dose of the statin to flood the bloodstream. If a patient complains of muscle aches, you must distinguish between hospital bed soreness and rhabdomyolysis, a dangerous muscle breakdown. A CK lab level is the only way to confirm if muscle fibers are actively dying. Finally, aspirin keeps platelets slippery by inhibiting the COX-1 enzyme, preventing the clumped clots that cause heart attacks. That slipperiness comes with strict contraindications. Aspirin is a non-starter in the 3rd trimester of pregnancy and for children recovering from viral illnesses where it can cause fatal liver and brain swelling. Common maintenance drugs have a significant impact on hemodynamics if their specific mechanical rules are ignored. Mastering these medications means understanding that every adjustment to the drain has a corresponding effect on the pump. You are no longer just passing pills. You are managing a complex mechanical system. Visit the SuperNurse AI platform to download our visual guides and hit the notification bell so you never miss a bedside breakdown. The medication administration record is a guide, but your assessment is the final safety net that keeps the patient alive.